Professor Husseini, thanks for the organizing committee for accepting the paper. So this is a little bit out of the box talk. This is primarily a research topic. And I'll just bear with me if I can take you through the idea and the results. So we have no conflict of interest, and we are, this paper is funded partially by the Saudi Association of Neurological Surgery in the form of a grant. So we are all familiar with the art of palpation. When we entered medical school, all of us were taught how to palpate the liver and the spleen and to feel for hard objects that may represent a tumor. So these changes through organ palpation was very critical for making a diagnosis. However, in deep organs, this art of palpation sometimes is difficult. So a new idea came up is why not do elasticity assessment? And it was done using an ultrasound, mainly in the liver and the breast, but was also done and expanded to many organs: thyroid, spleen, prostate, lymph node, pancreas, uterus, and many others. With the idea is that if you have if a person has a breast lesion, and if it is shown on elasticity that it is a bit hard, maybe that can avoid a biopsy, and you can predict if it's a tumor or a benign. However, the elasticity of the nervous system has never been assessed in vivo. There was one study before that assessed the elasticity of the spinal cord in vitro, and that was in one dog in 1978 and published. I will go over that. So how can you assess elasticity using ultrasound? There are many techniques. The main two methods is a strain elastography. So elasticity is deforming the tissue and seeing how much it comes back to normal after you release the deformation force. It's a relationship between stress and strain, and that is called strain elastography. However, that's not very appropriate for the nervous system. You cannot compress the spinal cord to produce elasticity. So the other technique is using a shear wave elastography, which sends a wave through the tissue, calculates the speed by which this wave goes, and then calculates indirectly the elasticity. So it is a relationship between the stress that you apply to the tissue and the strain that you can measure. So we used 10 greyhound dogs with a mean age of 14 months. All dogs were appropriately anesthetized and monitored during the procedure with endotracheal or with laryngeal intubation with IV fluid running. We did a cervical laminectomy under neuro monitoring in the form of motor evoked potential. Obviously, we had a research protocol approval from our ethical committee in our university in Riyadh, Saudi Arabia. And this is the laboratory, and this is the dog intubation and the team in action. And this is the neuro monitoring electrodes. So these diagrams shows you how we did the procedure, we did the laminectomy, and it shows the ultrasound machine and how we applied the probe to measure the elasticity. And this is an important slide. So what you can see on the bottom there, you see a spinal cord. And for those not familiar with intraoperative ultrasound on the spinal cord, imagine you're looking at an MRI, at a sagittal MRI. You will find the dura mater in DM, pia mater PM, spinal cord, and central canal. And you can see on the elasticity map above it, in the red diagram, the more red the color is, the more likely the tissue is stiff or less elastic. And you can see that the dura mater elasticity is 62 kilopascal, and the spinal cord itself measured about 18 kilopascal. So that does really consist, what would you expect? You would expect the dura to be harder than the spinal cord. And these are the numbers that we came up with in the 10 dogs. And what we did 3 random samples in 3 acquisitions. So every acquisitions, we did 3 random samples to be consistent. And this is the protocol we followed. And these are the measurements. And they coincide with our anatomical understanding. So we went further and we applied the compression to measure whether the elasticity is responsive to an external compression, like a patient with a tumor compressing the cord, or a disc compressing the cord, or a fracture. And sure enough, we inflated in 2 stages, 8 millimeter stage and 13 millimeter stage. And with every time, the elasticity goes higher. And you could see when we compressed with a balloon in the top left, in the bottom left, you can see how the red color has changed. And the elasticity now has gone from 18 kilopascal to over 250 kilopascal. So you have a way of measuring how the spinal cord is compressed that is more than just anatomical. And this is what we are testing in, what we were probably looking at testing one day in a patient with such an MRI. So the use of a 13 millimeter balloon led to a significant 12-time increase in spinal cord elasticity. 13 millimeter balloon resulted in stiffer spinal cord compared to an 8 millimeter balloon. And this balloon we took from the cardiac catheterization laboratory. So the motor evoked potential was not obtainable from the lower limbs in 2 of our subjects. Among the remaining 8 subjects, baseline MAP was lost in 3 after compression, and it was either maintained or demonstrated slight change with compression in the remaining 5. Just as a comparison, the mean elasticity of a normal Achilles tendon is 290. So your measurement of a compressed spinal cord was as stiff as such a hard structure. And this is the curve. Increasing compression increased the stiffness of the spinal cord. In one dog, we had different areas on the B mode showing different echogenicity, reflecting some sort of trauma. This could be a vascular event during the procedure, could be a traumatic event during the laminectomy. However, the elasticity of these small dots was different from the normal elasticity of the surrounding cord. This is the one study that was published before in 1978, where they used tensile strength, uniaxial tensile test model, where they cut the spinal cord and measured the amount it retracted and estimated the elasticity. And sure enough, their physical means of assessing elasticity was correspondent to our ultrasound mean of the measurement. Was there any MRI testing spinal cord elasticity? It's very challenging. Up to date, there is no single publication on the topic, except one abstract from Mayo Clinic in 2009 that measured elasticity and corresponded to 12 kilopascal, but the progress is going. Useful application of ultrasound elastography was also published by Chan et al. In epilepsy, where they identified intraoperatively an epileptogenic focus that was not shown anatomically or in routine ultrasound, and they resected the lesion. So in conclusion, using ultrasound elastography, normal spinal cord elasticity values were identified in dogs. Our results agree with basic anatomic knowledge of the degrees of stiffness of the spinal cord and the surrounding structures. The current study demonstrates for the first time in an animal, living animal, the spinal cord stiffness following application of compression. So this should support future studies in the subject. And currently, there is no modality other than spinal cord elasticity using ultrasounds capable of defining the tissue elasticity. The portal and economic features of this technique may exhibit potential future diagnostic and prognostic implications in various pathologies of the spinal cord. I would like to finish the talk by thanking everyone who helped make this a successful story, our nurses, our administrative lab, our animal lab, the companies that supported our study, and the Saudi Association of Neurological Surgery for supporting the study. This is our laboratory, and in particular, I would like to recognize the only person who is dressed in blue, Dr. Abdurrahman Al-Bakr, who is doing neurosurgery residency, who made this a truly fruitful experience and possible. Thank you. And it was published in Journal of Neurosurgery Spine this month.